Hello, and welcome to a PowerPoint presentation on aquatic physical therapy. What is aquatic PT? It's really just using the properties of water to facilitate all the things that PTs ordinarily do, and some of those things are listed here in this slide. In general, you can use aquatic PT to perform range of motion exercises, resistance training, to facilitate weight-bearing activities, as well as to initiate functional activity replication while minimizing the risk of injury and re-injury. So in thinking about using the properties of water for physical therapy, what properties of water am I talking about? The first property that I'd like you to be aware of is something known as buoyancy. And essentially, buoyancy is nothing more than the upward force from the water that works opposite to gravity. Two important things to worry about as far as buoyancy in aquatic physical therapy is that it can off-weight you depending on the volume or the depth of water that you're in. If you look on the left-hand portion of the picture down below, you can see that if you're down to about C7 level in your neck, that you're only about 10% weight bearing on your body. If you're at the level of your xiphoid, your weight bearing is approximately 33%. And if you're in water that is in the depth of your ASIS, you're only weight bearing about 50% of your body weight. Another thing to be aware of with buoyancy is shown in the figure on the right-hand side of the slide. If you imagine being immersed in water, looking at this individual's left-hand arm, if I wanted to use buoyancy to assist my range of motion, I'm going to have the arm float up, and that way I might get a little bit more range of motion. In contrast, the arm on the right-hand side of the body is resisted by buoyancy, so I might use this kind of motion or direction, not floating or pulling down against the water, to provide resistance training. Another property that you need to be aware of that is used by physical therapists in the aquatic environment is known as hydrostatic pressure. Hydrostatic pressure essentially will provide a 3D pressure, a three-dimensional pressure on any body part that it's exposed to. You should also be aware of the fact that the greater the depth of the body part, the greater the pressure. So if you look on the picture on the right-hand side of the slide, you can see that this individual's lower extremities are at a much lower depth, so they'll receive more hydrostatic pressure, pressure from the water, and the individual at chest level and upper extremities will receive much less pressure. And again, hydrostatic pressure is just the pressure exerted by water on immersed objects. If you immerse something a little bit, you don't have as much pressure as if you immerse it further down into the water. Another property that you need to be aware of is known as viscosity. Viscosity is nothing more than the friction that occurs between molecules of liquid that results in resistance to the flow of the liquid. You can see here the slide shows three different types of viscosity. You have low viscosity, which is water. Olive oil would be considered a medium viscosity, and the highest viscosity would be considered honey. So imagine you're in a pool environment that's filled with honey. If you try to move your arm through the honey, it would require a lot more of your force because the honey is much more viscous than that of water. Another physical property of water is known as surface tension. You can see in the left-hand side of the slide that the surface tension is of the water, the surface of the water is acting as a membrane that is supporting the paperclip in the water. And what actually happens here is that when the water molecules interact together, they create a force, and that force is known as the surface tension, and it's the surface tension itself that actually allows the paper clip to stay afloat. If you broke the surface, so if you went down and you just touched the corner of the paper clip, it would sink because you actually broke the surface of the water. So why this is important to know for physical therapy is that if you're moving an extremity through the surface of the water, you'll actually be performing more work than if you kept the arm under the water. Or using water for physical therapy is called hydromechanics. Essentially, hydromechanics think about two or three different components of flow motion of the water. The first is known as laminar flow, and the laminar flow is shown on the left-hand portion of the slide. Here you can see that all the water is running parallel to each other. So this happens during very slow motion, and during this slow motion, there's relatively little friction between the different layers, all running parallel to each other. This is in contrast to what you see on the right-hand side of the slide, which is called turbulent flow. And turbulent flow here you can see as being represented lower down in the slide, close to the layer of sand in this water. There's an obstacle in the way. It looks like a little sand dune. So as the water's flowing toward the sand dune, it's being pushed away and creating turbulence in the water itself. Interestingly, you can see up top, there is one little bit of laminar flow right at the top, but anytime the water hits an object, you're going to create turbulent flow. One final term to be aware of is called drag, and drag is simply a combination of turbulent flow plus the viscosity of the water. Clinically significant things that you should be aware of for drag are shown in this slide, where on the left-hand portion of the slide you can see what's called a continuous pool, where the machine that's in the front of the pool is putting out a forceful flow of liquid, and in order to maintain the position when this forceful flow of liquid is coming toward the swimmer has to swim pretty hard so she won't get blown back. Another important principle for drag is the use of paddles or any kind of equipment in the pool. And here, the application of the equipment increases the drag and resistance as the patient moves the extremity through the water. As I mentioned, there's a number of different pieces of special equipment to be aware of if you're going to work in an aqueous or aquatic PT environment. You can have collars and rings, belts, and vests, and these are all going to be flotation devices to help you stay afloat. There's also swim bars. You can see in the picture on the right-hand side, the weights or the swimming weights that she's using, those are known as swim bars. You can have noodles, which are just the standard flotation devices you see used by kids in pools. You can have gloves and hand paddles. And again, those are going to increase the surface area of the hands and make the resistance exercise or the range of motion exercise more easy or more difficult, depending on the function. And finally, there could be fins and kickboards. And again, same as the upper extremity special pieces of equipment, you're either going to make the exercise that you're trying to perform more difficult or easier, depending on which way you're moving. One more thing to keep in mind when you're working as an aquatic physical therapist is water temperature and prescribing therapeutic exercise. You should be aware of the fact that water conducts temperature 25 times greater than air does. That means when you get in the pool and the temperature is a little bit lower than your body temperature, you're going to get cold pretty quickly. Because of this, you want the patient's max immersion time to be about 20 minutes. Recommended water temperatures that you need to be aware of for general flexibility, strengthening, and gait training, so just general therex kinds of stuff, is between 26 and 35 degrees Celsius. Realizing that normal body temperature is 98.6, which is about 37 degrees Celsius. So you just want a little bit of a decrease to a much lower temperature. Also, if you're doing cardiovascular or aerobic training, you want the temperature to be quite a bit lower. 26 to 28 degrees is what's recommended. You should also be aware that a lower water temperature is also recommended for patients with multiple sclerosis. Always have to remember your precautions and contraindications for everything we do. Really important thing to know. The first, all the precautions that you need to be aware of are listed on the left-hand side of the slide, and you can see that this guy, even though he's got lots of flotation devices, he is very afraid of the water. So it's, the recommendation, if you have a patient who's afraid of the water, make sure that they're comfortable before you're working with them in the pool. Because they're afraid of the water, you're going to increase muscular tension and just make the person unhappy. The water itself should be a calming influence, but with that increased fear, it negates the purpose of using the pool. There are also some neurological disorders. For example, if a person is on seizure medication, you want to monitor them closely. Any kind of respiratory disorder or cardiac dysfunction, again, monitor them closely when they're in the pool. And any kind of small open wounds should be covered with an occlusive or a watertight dressing, and any open lines should be clamped tight and fixed to the person's body. This slide shows all the various aquatic PT contraindications to be aware of. And I'm not going to sit here and go through the list with you, but you should definitely be aware of these. One other thing that I'd like to mention is Dr. Raddick says that anyone who's interested in experiencing what it's like to be an aquatic physical therapist, there are multiple clinical rotation sites that do perform aquatic PT, and he'd be happy to set you up with that kind of experience if you have an interest. Okay, thank you.